This lesson reviews what we have learned. Remember, the quality of the resources reflects in the quality of your paper. Double check and make sure that your information is current, factual, and authoritative. Review your research and ask the following questions. Who wrote it? What is the scope? Where was it published? When was it written? How is the information presented? Do the authors hold credentials as authorities for this research? Make note of the authorship of a journal article. You should see the author's name, academic credentials, and professional affiliation. You may want to see if this author has written other articles on this topic. Books you use should clearly indicate the author or editor's name, credentials, and professional affiliations. Here is a list of contributors to this text on distance education in nursing. It is easy to identify the qualification of those contributing to this publication. When determining the scope of a publication, ask the following questions. What is the range of view? How can this research be applied? What is the operation or methodology? How effective were the outcomes? The scope of this article is clearly displayed in an abstract, discussing the purpose, background, and conclusions of the authors. Also listed here are key words to help describe the article. Where was the article or book published? This implies the question of why the item was published, and takes into consideration the biases in the publication. Bias is not necessarily a bad thing. However, it should be recognized in preparing your findings. Articles in the Journal of Christian Nursing carry a spiritual bias. The authors in this journal believe that spiritual content is part of nursing practice. This point of view must be considered when using articles from this journal. Minority Nurse sees nursing practice from a particular point of view. Articles are written from the point of view of minorities in the workplace. Currency in the sciences is very important. Generally, in the sciences, articles which are over 5 years old are considered too old. Of course, there are always exceptions to this rule. As mentioned previously, books may present a different criteria. However, newer is better. In evaluating your sources, it is important to note how the information is presented. The main question being, does the information fit normal academic form? Can you follow the evidence trail? The abstract of this article clearly displays aims, background, design and method, results, conclusions, and relevance to clinical practice. Citations are clearly marked throughout the publication. Data from the research is clearly marked in tables and in graphs. Conclusions and relevance of the research is clearly noted. References follow a standard academic format. This article fits the standard for scholarly communication.